Welcome back to CT Buzz. The APT Foundation is launching a new campaign to expand access to opioid use disorder care. And joining us live to explain more is Dr. Lynn Madden, President and CEO of the foundation. Happy to have you here with us.
Thank you, Jillian, and thank you so much for inviting us to be here today.
Absolutely. Let's start by talking about the foundation and what you guys are all about.
Sure. Well, APT Foundation has been around for a while. We've been here in New Haven for more than 50 years. What we do is we deliver treatment for substance use disorders and mental health care, and we are particularly well known for delivering treatment for opioid use disorder, using medications like methadone and buprenorphine. So we're highly focused on access to treatment and on the delivery of evidence-based care for folks.
All right, and you have a new campaign, and that campaign is called Let's Break Barriers to Treatment. Medication for Opioid Use Disorder Works. Now, what specific barriers are you looking to overcome with this campaign?
I think one thing that's really important for people to understand is that in the United States last year, more than 107,000 people died from drug overdoses, and over 80% of them had opioids involved, right? Opioid use disorder is a treatable condition. We can reduce that number. So first and foremost, it's important, I think, to help people navigate to treatment for opioid use disorder, particularly treatments with medications like methadone and buprenorphine. Yet only 1 in 5 people, giving our best estimates, really do access these medications in a given year.
Yeah, people might not even realize how many people are impacted. Now, let's talk about some of the key elements of the campaign.
So some of the key elements of the campaign really have to do with education, trying to educate the general public, as well as professionals and all the constituencies that we have in our state and in our country about the fact that medications are effective. The medications themselves and the treatment, as well as opioid use disorder and substance use problems in general, are highly stigmatized. So part of this campaign is oriented toward helping people understand opioid use disorder and other drug use disorders as common and treatable, and hopefully that will begin to break down some of the barriers that are created by stigma.
Yeah, absolutely. There's definitely a stigma attached from the general public about these types of conversations. And what is the impact you're hoping the campaign will have beyond that?
Yeah, that's a really excellent question. So the impact in general is twofold. First and foremost, let's really care about each other. Let's break down these barriers to treatment. Let's support folks who want to navigate into care. Let's support people in talking about the drug use problems that they may in fact develop. And then secondarily, I think we can measure that in a couple of ways. One of them being really in the number of people who die from overdose, and secondly, in the number of people who actually access evidence-based treatments.
All right, and then how can people get involved, support your mission and what you're doing?
Yeah, well, what we're doing here today is a real good start for that. But a way that anyone can get involved is have a look at our website, aptfoundation.org. We have some excellent resources on the website, some that we've developed and some that have been nationally developed that we've put links to. And I think, again, the second part is really engage in conversation. Engage in conversation with your friends, your neighbors, with community groups. This is here. We have one of the biggest opioid problems in the country on the East Coast, and Connecticut is no exception to that. And we need to talk about it, and we need to help each other.
Yeah, getting the conversation started is often a good place to begin.
Yes, absolutely.
All right. Thank you, Dr. Lynn Madden. Wonderful to have you here with us.
Thank you, Jillian.
Yes, and we will have that information on our website, WTNH.com. Keep it right here. We'll be right back after a short break.